Hello, everyone. Welcome to our traditional live questions and answers session. On usually once a month on Friday, we get together to discuss a variety of the topics. And this session is open for not just my patients, who always nice to see here, but also for the new clients who might be considering to learn about functional medicine and understand how this approach is different. Welcome. My name is Dr. Elena Klimenko. I am an internist and functional medicine physician in Midtown Manhattan, and I'm very happy to greet you at my little live Q&A space. Today, we're going to talk about collagen and how collagen affects not only our joint health, but also almost every biological system. That was new for many of my patients, and I would like to share this news with you. So today we're going to talk about variety of the issues, but agenda is basically to understand the science behind the collagen and how collagen is broken down, how it is synthesized, and also look at how can we improve the collagen state in our own body. We're also going to touch upon the fact that not all the collagen is made equally and what is the difference. And then we'll just break with small announcements, what's new in our practice. As I mentioned, this live Q&A is attended not only by my patients, but also by new clients. So we will go through the slides. That is the recording session. So please keep yourself mute. And once we complete their educational portion, I will turn off the recording and we can chat. You can unmute yourself and speak freely. Okay, so let's move on. So initially, when collagen hit the market, a lot of it was used for aesthetic and skin purposes, because there was a study that showed that if you take external collagen, it will improve the quality of your skin. So everyone started using it mostly for the skin health. But we didn't really realize that the benefits of collagen will extend and expand beyond the skin. So what did we know now? We know that the collagen is the most abundant protein in the body, okay? So there's a variety of different collagen types. There's over 25 different types of collagen, and it all depends on which organ collagen needs to support. However, 90% of collagen in the body is type 1 and type 2. So type 1 collagen is building our tendons, our ligaments, fascia. For those of you who don't know what fascia is, if you ever cooked the chicken and you peeled off the skin from their muscle, from their tissue of the chicken, and that white film that is extending from the skin into the chicken breast, for example, that's the fascia. Fascia surrounds every cell in our body. It attaches all the way to the bone, and from the bone builds the connection to the skin. It's sort of a matrix. So the biggest part of this matrix is the collagen. That's the structural part of fascia. It also, type 1 collagen builds our skin and our bone, our organs, heart valves, and the blood vessels. That type 1 collagen, as well as type 2, is the most abundant in the body. Type 2 collagen is building more of their gelatinous tissue, like hyaline cartilage that you can find in the nose and their ears. Those are their cartilages, right? And articular cartilages, for example, the surfaces of variety of the joints, your knee joints, your hip joints, their shoulder, elbow, all those articulate surfaces are covered by their cartilage, which is made of the collagen type 2. And most importantly, intervertebral discs. So the discs that are that gelatinous tissue that keeps our vertebra accommodated with each movement, and the gelatinous discs that getting drier as we age, and ultimately they may crack and we get herniation. All of that is the collagen. So now you understand how important collagen is for the structural purpose of our body. And as we grow older, you can see that we are losing this beautiful substance. But what is collagen built of? It's made of the building blocks, amino acids. There's a variety of amino acids, but there's the three most abundant amino acids that are building collagen: glycine, proline, and hydroxyproline. Exactly, there's definitely more amino acids, but those are the three major. So any amino acid supplement that you will be taking, or any food that you're eating, should be broken down into this essential amino acids that will be eventually building your collagen. And there's two very important cofactors. Not everybody knows that even if we have amino acids on board, if you take it as a supplement, or your digestive tract is doing a great job by breaking down the piece of chicken that you're eating into those amino acids, you need magnesium. And magnesium is a cofactor that builds those amino acids into these chains. We call it polypeptides. Those are the chains that consist of 10 or more amino acids. And the polypeptides ultimately will be wound or braided into this triple helix structure that, and we definitely need vitamin C for that. So this triple helix collagen structure that is being built and modeled in our body, and our body does it all the time, provides the strength for the connective tissue. That's what holds our joints in the suspended state. That's what keeps our spinal vertebra in the suspended state, so we're not collapsing those discs. This is what supports our discs, intervertebral discs. So collagen is extremely, extremely important for structure support and the posture support. But the problem is that the collagen, unfortunately, over time will be breaking down. And this process of breaking down and synthesis of the new collagen happens all the time. When we're younger, as you can see from 0 to 20, this process happens with their preference of the rebuilding collagen. As we grow older, from 30 all the way to 80, we unfortunately more in the anabolic, catabolic state, when we are not rebuilding collagen, but we're breaking it down with the highest speed. There's many factors and participate in this collagen breakdown. Of course, age is on its own is the factor. Of course, there's a hormonal changes that will help us to keep our collagen in more of their rebuilding state. Genetics, of course, if you can look at sometimes mom and the daughter will come to my office, and you can see that if mom has a nice supple skin in her 60s, her daughter will be probably aging the same way. However, unhealthy lifestyle will play a role in a faster breakdown of the collagen. That's why some women who spend more time, or men spending more time on the sun and do not support their skin from the sun damage, I'm talking about the face, will develop more wrinkles sooner in their lives. People who smoke, who expose the skin to oxidative stress, will unfortunately be more on the destructive side of the collagen. But injuries, okay, injuries, for example, if we're talking about repetitive injuries of the knee runners or athletes, these people will wear off their cartilage and collagen much faster than someone who is a couch potato. So everything is in moderation, as we say, right? Inflammation will also promote the breakdown of collagen much faster, and biomechanical instability. What do I mean by that? As you probably know, most of us are asymmetrical and we are misaligned. That's why we need to do a certain body work. Either it is a chiropractic adjustments or osteopathic manipulations or acupuncture, or massage therapy, myofascial release. All of that, it will support our biomechanical stability. So we distribute our weight in an equal way. So it's not, it doesn't put more pressure on one side of the body or another, because that will create wear and tear in one side more than another. So biomechanical stability is also very important to consider how we break down collagen. So collagen actually, as I mentioned, go much deeper than just skin and aesthetics. It actually supports the health of variety of the areas of our health. Musculoskeletal health, of course, there are tendons, ligaments, cartilage, but also gut and immune health will be supported by adequate amount and production and turnover of the collagen. Believe it or not, cardiovascular health, oral health, women and man health, all of those areas are so important, very important areas where collagen plays a role. So let's go over each of those biological systems. So musculoskeletal system, as you know, type 1 collagen supports tendons, ligaments, fascia, bone. Type 2 supports collagen, joints, discs in the spine, and 90% of bone is actually collagen. So that was a surprise for me when I started working with functional medicine knowledge, that osteopenia and osteoporosis is the disease of their protein deficiency, because our bones are made of the collagen, and that works as a scaffolding and support for the minerals to get embedded. So if we live in chronically deficient state of the protein absorption, that's where the gut health comes really important, right? If we don't absorb, if we don't digest the proteins that we eat, we don't absorb it, and it not reaches the bone, bone will start leaking out their proteins, the amino acids. The turnover of the collagen, that breakdown process, will dominate the rebuilding of the collagen. So remember, 90% of bone is the collagen. So not one of the most dominant amino acid that found in collagen is glycine. This is the key amino acid to build and maintain our muscles. And glycine is actually available as the powder that you can take at nighttime, and it helps you to also relax and sleep better. So glycine is really important amino acid to consider to incorporate into your nighttime routine. But let's talk about the effect of collagen in the gut and immune health. Did you know that type 1 collagen supports and maintains more than 60% of their gastrointestinal tissue, and provides that sustained integrity of the gut tissue? Without glycine and proline that is found in the collagen, we will not rebuild our intestinal barrier. So for my patients with the leaky gut, glycine and proline are their routine nutrients, and it's on top of the glutamine that has other function, but glycine and proline will be important amino acid in the structure of the gastrointestinal barrier. So also, as you know, 70% of our immune system is in the gut. So therefore, if we don't have that integrity of the gut lining and intestinal barrier, we cannot have a healthy immune system. So all of that is connected. We are in the matrix. Our body is the matrix where every system does not exist in isolation from another. So this story is about collagen and how it links our cardiovascular health, our gut health, immune health, musculoskeletal health, and as I said, cardiovascular health, healthy heart, blood vessels, arteries, all of those structures will have type 1 and type 3 collagen, which is very important to maintain if we want to have healthy cardiovascular system. Surprisingly, collagen type 1 also supports the health of our oral health. I don't know if many dentists talk to the patients about it, but it's so important, especially if we have a loose teeth. As some of you experience with age, we start getting our teeth become more loose, not only because of the infections, but also because the body is in this destructive mode, or collagen decomposition, and then we get tooth infections much easier. We losing the dentin, the teeth become much more sensitive. Gums are receding. We get periodontal disease, and periodontal ligaments become much looser because the tooth is sitting in there in the gum, and it is being held by ligaments. So if we don't have healthy collagens, those ligaments are not strong. So here's another very important area. And of course, the women and men health. Type 1 collagen supports and maintains health of our hair, skin, and nail. And the collagen type 1, 2, and 3 will maintain our muscle health, bone health, joint health, and especially important for the injury repair. So if anyone had any injuries, collagen becomes irreplaceable nutrients. Also, don't forget, especially for women in reproductive age and post-reproductive age, type 1 and 3 collagen is extremely important for our pelvic floor tissue. How many women in their even 40s and 50s complain of their incontinence, right? And this is the pelvic floor and pelvic organ health. Your bladder, your bowel, your reproductive organs like uterus and ovaries, everything is actually held in place with those ligaments. And ligaments, as you by now know, are made of the collagen. So please think of the collagen. So not all the collagen is made the same. There's a lot of different collagen on the market. You can see gazillion of different products. What do you want to look for? You probably want to look at the either peptide form or hydrolyzed collagen. Why? Because it's a pre-digested collagen. It's a much smaller particles and molecules that are easier absorbed by your gut. And especially important, don't forget the importance of those cofactors, because as we just discussed, it's not enough just to have amino acids that will be connected to their chain, the polypeptides, and then weaved into their triple helix structure. We need magnesium, we need vitamin C for this process to happen in the most efficient way. So I want to just talk about the case presentation. Dorothy is a patient of mine, and she's 45-year-old female who presents with the knee pain and stiffness. She is a very active runner, and she's training for upcoming marathon. She runs about 40 miles per week on average and has been a runner since she was 16. That's a huge amount of workout for a 40-year-old, for anyone. But she is actually sees osteopathic physician who performs a thorough history and postural exam. And he found that a misalignment pelvis and leg length are in unequal length. So meaning that they have a length inequality. And that's very common. So remember, we talked about the misalignment and importance of resolving it, because otherwise we're wearing down their joints on one side or another. So orthopedic tests confirmed that she has a positive running knee, and X-ray started showing the deterioration of their cartilage by showing the narrowing of their joint space on the X-ray. So those are the first signs of arthritis. So what we did, the patient is prescribed a personalized musculoskeletal pain that consists of not just nutrients, but also osteopathic manipulation, therapeutic exercises, and orthotics. It's really important for you to get your feet evaluated. So and usually your podiatrist, and we do have a holistic podiatrist who we work with, will evaluate your foot and provide adequate support. Because with age, our arch starts dropping, and that pulls all their connective tissue of their leg, including knee and hip, out of alignments. And then we start wearing down our meniscus in the knees, our hips, and spine, ultimately. But from the functional medicine perspective, Dorothy also become aware of the importance of the nutritional plan and wellness plan. So we incorporated this holistic approach to her knee pains. Of course, she is wearing and tearing her knee, but also what can she do? She's not planning to stop running. She wants to continue to run, and she's training to marathon. How can we support her? So we put her on an anti-inflammatory diet. We eliminated all what we know now, most commonly inflammatory foods, things like some grains, dairy, sugar, of course, soy, sometimes, especially if it's non-organic soy, and corn. Conventionally grown corn is probably one of the worst things to eat, and it's everywhere, right? We teach our patients what is their organic food. Where can you find organic food? How can you identify organic food? You'll be surprised. Yesterday, I saw a patient. She is a health enthusiast, eats clean. But when we started talking about, do you know how to buy organic food? What is the dirty dozen? What is the clean 15? We think people know that, but not everybody knows it. So we do educate our patients how to identify what label to look for to buy organic food. What food must be organic and what food might be conventionally grown. Importance of water intake. Every patient in my practice gets the water prescription. You need to drink half of your weight in ounces. For elder people, maybe a little less than that, especially if they have pelvic floor imbalance and they have incontinence. So we need to work and slowly increase the water intake. But water is life. We're made of water, and we need the replacement of water all the time. And we most of us are water depleted and dehydrated. And then, of course, targeted nutritional support. Collagen building nutrients. As I mentioned, there are collagen, peptides, essential cofactors as magnesium and vitamin C, and the cartilage rebuilding nutrients, inflammatory and modulating nutrients, things like curcumin, omega-3 fatty acids, and other nutrients. So after this program, she successfully completed her marathon and actually got rid of their pain in her knees. On the follow-up physical exam, she had no pain and no stiffness. Her postural exam that is provided by our osteopath in our practice revealed a level pelvis and equal leg length. Through their exercises, she strengthened their weaker side of her body, and now she's much more aligned, and she's not wearing down the joints. So in the follow-up imaging actually showed that the joint space is returned to normal, and there's no signs of degeneration of her knees. That's a significant accomplishment on her end, because she did all of that. So for what would be the next step? If you're interested to work with us, please feel free to scan this QR code on the screen and book your discovery call with my team. They will be happy to answer any of your questions, how you can become a patient. We have a variety of the options to become patients. Some are more inclusive, some are less inclusive, so you can find what is best for you. But don't forget, we always like to give you a little gift, because you're found time in your busy schedule to join us today. So we're very grateful. So please visit our e-store and use this Vital 15 code to get this 2 important nutrients. Remember, magnesium and vitamin C are really important to build your collagen if you have adequate amount of those amino acids. This is a great duo, and you'll get a great discount on not just rebuild your muscle, but also support your immune system. The winter is coming. Everybody would need vitamin C. So this vitamin C is one of my favorites because it has bioflavonoids and protein that improves their absorption of vitamin C, and it works really well in my practice. And then I would like to also recommend some other very interesting products of the collagen. So this whole body collagen is one of my favorite because it has 3 proprietary blend of collagen peptides that support not only joints and ligaments and soft tissue, but also bone strength, as well as their nails strength and hair strength and the skin firmness. So 3 different peptides that are been clinically studied, and they all in this whole body collagen. You can order it through our office. You can just call us and we will ship it to you, or we can give you prescription through the full script if you are our existing patient. It exists in the powder form as well as in the tablet form. I prefer the powder form because my morning, especially if I am working in the office, is very hectic. So I have only 5 minutes for my breakfast. It's usually protein powder, and collagen is being one of them. I like to rotate my protein shakes. So collagen is usually that I use on Mondays. And I would get all my amino acids and peptides through their protein shake. If you are still young and you don't care that much about your musculoskeletal health, but you care only about your beauty collagen, your skin, your nails, your hair, this is their just one peptide that will promote hair strength and skin. So Lustriva is their brand that has been clinically studied and proven to improve the collagen for their beauty. So that's why we call it whole beauty collagen. You can also get that through our office or full script. And Lustriva is actually a patented and clinically researched blend of stabilized biotin and silica along with the peptides. And that's why the skin reacts so well to it. But of course, it supports other things. It's just a marketing trick to attract women's and men's attention, because beauty always catches our attention, right? We all want to look healthier and younger, and there's also magnesium in this preparation that will that has a great dissolvability and absorption, and it will help biotin to get to the right place. And it exists also in unflavored and unsweetened powder, which makes it so easy to add to your protein shake. So, and it's gluten and dairy free as well. So whole beauty collagen. Also, there's a really cool product that I discovered, and it's specifically great for rebuilding your muscle mass. The performance peptide. We recommend it for athletes as well as for aging adults. It's a great way to maintain your muscle mass, and it's made from fava beans, so it's completely vegetarian. So for those who care about staying on the vegan side, this is a great performance peptide. It's definitely a cutting edge technology that was discovered based on advances of artificial intelligence, which sound already fun, that we are generating the supplements with AI, and it gives you muscle supportive peptides. So it promotes the healthy body composition. And how do we know? Well, there's a study actually was done that showed that this product will support their muscle mass in the adults when they do resistance exercise training. In our practice, we perform a test called body composition test My patients are usually encouraged to have it done at least once a year so we can track how's their body composition changes. Is it stable? Is it deteriorating? Or people are rebuilding? Are they reducing the percentage of body fat? Is the lean body mass is better? Is the cell hydrated? That all those markers can be obtained from body composition tests. So it's a great test, and any functional medicine physician should do that test because that gives us a lot of information. And then, of course, if you want to reduce the inflammation in the body, our clear and vibrant bundle, again, you can use collagen 15 code if you want to order our ultra turmeric, which is the amazing and not only bioavailable, but also active form of turmeric. Actually, majority of the turmeric on the market that we have has to be transformed by your liver to the active form. And some of their transformation happens through the pathway that the toxins need to be detoxified. So now we have a dilemma. What is our liver going to do? Is it going to transform turmeric into its active form, or it's going to take care of the toxins? So I decided to remove this dilemma out of the equation and give people activated turmeric. So it doesn't have to go through this transformation. Leaving liver free to do its job, filtering and removing toxins from the body. Of course, we also have omega-3 that is great for inflammatory balance in our heart, brains, and joints. So don't leave your home without omega-3 fatty acids. Majority of us, at least when I test people, have a really poor ratio between omega-6, which is arachidonic acid and pro-inflammatory state, promoting pro-inflammatory state, and omega-3. So more omega-3s in your diet or in your supplementation. And vitamin C, again, as I already said, a few words about this. So a great trio that you can always use, take advantage of this offer for you as a thank you for coming and joining me today for live Q&A. For those of you who are new and you don't know yet, I recorded a digital program to introduce whole gut wellness. It describes all the intricate processes that are happening in the gut. Why is it important? Because all diseases begin in the gut, and many cures start with the gut. So gut is the place where a functional medicine practitioner always should start. So if you're interested to get this program, feel free to scan this QR code. We give you $50 off today. But interestingly, you can do it on your own, and it's very easy. Just get it and watch me teaching you about their gut health. Everything from leaky gut, autoimmunity, how you can overall support your gut health. But if you need support, we also offer 4 group sessions with the health coach for only the $449 that is outlined here, and you get $50 off. It's a great opportunity to get your understanding and support from our team to go through their initial phase of functional medicine. So here's the sneak peek. If you want to do that, if you want to see some of the videos, you can watch them from our Instagram or sign up if you want to get their small snippets from the program by scanning this QR code. And just few news, we still doing unstoppable IV therapy that helps people to recover from traveling, from cold, flu, COVID. We support people in all possible ways. We help them to detoxify, either with their detoxification cocktail or vitamin C, or some vitamins and minerals that we all can use, alpha-lipoic acid, phosphatidylcholine. We have a variety of intravenous therapy in our office. And if you are interested and want to learn more about this ugly, growing field of medicine, ugly mold, I should say, not ugly field of medicine, but ugly mold. As you can see, this moldy wall on the picture, we are inviting you for a free session, introductory session about mold and toxins and how can it harm our body and how you can heal yourself and heal your home. This is our supportive group circle introduction that will take place this coming Tuesday at 4 p.m. If you're interested, please email us to the office. You can always find the contact information on our website. And also we are supporting our patients who did their genetic test, 3x4 genetic test that we do in the practice. And if you order it with us, you get a free attendance to their monthly group coaching, usually lunchtime, the third or fourth Monday of the month. So also a great opportunity to learn about your genetics and to learn where do you need to focus your attention. You cannot cover everything, but knowing where your vulnerabilities will be really helpful for you to do a targeted support for your body in the process of healthy living. And just a reminder, if you are in Florida, I will be in Florida either next Friday or next time I'll be there in November. So if you have friends, family, or you are in Florida, feel free to call us and schedule an appointment with me there. And we are in Sunny Isles. And of course, remember, friends don't want friends to go to the bad doctor. If you want to refer a friend, feel free to do that. We are very grateful for any referrals you can do for us. And we have hundreds of testimonials online. They're all organic. They're all our patients. We do not buy testimonials. We just ask our patients to leave a review. And so you can read what people say about our practice. And thank you very much. I am really grateful that you found time from your busy schedule to join us today for our traditional monthly live Q&A and talk about collagen with us. So as a thank you, here's a 10% off that you can use for our shop that you can find on my website. So just use this SEPTQA10 code to get a discount.